Today, we are going to talk about stroke. One moment, you are normal. The other moment, you cannot talk, you cannot walk, you cannot swallow, and your life seems to be crashing. Today, I have Clemento Suarez as usual, and our buddy,
Yes.
Oh Joo,
Yeah,
joining us to talk about stroke. Suarez,
Thank you
quick
very
one.
much. Yeah, man.
Do you know anybody who has had stroke before?
Oh, yes. I know people who have had mild stroke
Okay.
and full stroke.
Mild stroke and
Full one, yes.
Okay.
Why? You think that there's no full stroke?
Oh, there's full stroke.
Yeah.
Okay.
So I know a couple.
Well, we'll come back to the full stroke.
Thank
so
you
that
very much.
You tell me about it. Oh, do you know anybody who has had
Yeah, I know two people. Yeah. My dad and also Jimmy Fox.
Who? Jimmy Fox.
Yeah, he's a...
The comedian.
The comedian, he had stroke.
Yeah, he had stroke.
So what do you understand by stroke? When you hear stroke?
When I hear stroke, I say, hey, wow, this is stroke. So I know that stroke, it happens here in the brain.
Okay.
If I'm right, say I'm right. If I'm
Talk
wrong,
your
tell me.
matter.
Me bar, we say me too. I'm from the street too.
Honestly,
So talk to the street matter. Who street are almost talk
No. Violent.
that street means violence.
That's why I'm shocked.
You have to be tough. You have to be tough in the street. What did I say? You have to be tough, and I can't let him, overshadow me like that.
Who told you the street
See,
you have to be
let's
tough?
do one thing. Raise your hands in the air. I see.
What next?
I
That's
see. Wave it.
all. Masa. What's happening?
I wanted
know.
to see something.
I know about him.
It's stroke into Ghana.
No. I wanted to check something. Some people.
But you were saying something quite.
Yeah. So it happens in the brain, right? And one thing I know about stroke is if the left side is, it's affected, which means the right side of the body won't work. If the right side of the brain is affected, the left side of the body won't work. And I know that there are types of strokes say mild in the other day.
Full.
Yeah. Yeah.
Oh God.
You say at the end of the day, we come answer.
Okay, mild. Any fool.
No, okay.
But something guys are correct.
No, be okay.
But man can full stroke.
Okay.
I know of mild stroke.
And what?
So I on mild.
Which one is mild stroke? Is it transient ischemic attack?
Yes.
Doc, what do you mean by transient?
We'll talk about it. But what you know about
mild
stroke?
stroke you are almost getting the stroke, but because of some intervention.
Okay.
Now so through therapy you can even come back to normal. Yes, that's what normally we call it mild stroke. Okay.
So let me also try and then break down what stroke is all about. Yeah. Stroke is basically an attack on the brain.
Yes.
So what's a heart attack?
Yes.
An attack where?
On the heart.
Heart attack where?
What heart attack
on
or pancreas? I was by heart attack or pancreas.
So stroke is stroke is an attack on the brain.
Uh-huh.
So it basically happens, with the brain, there's blood moving through the brain, blood will go anywhere.
Yes.
So at a point in time where the blood supply to the brain is compromised, we can simply say you have a stroke.
Yes.
Into brain, what feeds the brain, what gives the brain oxygen is the blood. So there are two main types of stroke. Mm-hmm. You have what we call the ischemic stroke and the hemorrhagic stroke. What's that?
I've heard of the hemorrhagic stroke.
Yeah.
And I've heard of the systemic.
It's not systemic. It's not systemic.
Ischemic.
Ischemic.
But the most common ones is the ischemic. It happens
ischemic stroke and what?
Hemorrhagic. Those are the two main types of stroke.
Ischemic and hemorrhagic.
Which of them is the most common?
Is the ischemic.
What guess and answer?
No, I'm not guessing. Because I know
there's something you've not heard before.
Only I've heard of
because what I've heard
it's not
common.
Uh-huh.
So if that one is not common, then the common one is
how
ischemic.
common sense is this? What is the common sense?
See,
you've heard something that is not common. Mm-hmm. How did you hear the uncommon one? The common one you've not heard.
That's what kind of mention.
No, I didn't hear common. I didn't hear why is it common?
Because it's everywhere.
It's everywhere, but you've not heard of it.
I've not heard of it.
But the one that is not common, you heard of it.
I've not heard of chemololiasis. Have you heard of chemololiasis?
I've heard it.
You've heard of chemololiasis?
Yes.
What disease is it?
I don't know it.
You see, you don't know.
Yes, but
it's
I've heard
common.
it.
It's common.
I've heard.
What disease?
I said, I don't know.
Easy. Hemorrhagitis is very common.
But he's right.
What,
anyway.
okay, what's it? That's a hemorrhagitis.
It's a disease.
You just said, I have not heard of hemorrhagitis. Have you heard it? I said, yes. After the Unimad crow.
Ah,
Bomb moklat.
Doc,
Yeah.
excuse me, let me beat this guy.
Don't beat him yet.
Beat
The
me.
time you beat him will come.
It's also a defect. This cat.
But he was right. The ischemic stroke is
That
the
is a
commonest.
mild stroke.
No, it's not a mild stroke. It happens in about 80% of the people. Sometimes even to up to 90% of the time. And the other one is the hemorrhagic stroke. So let's try and get the difference because one of them is very deadly.
Yeah, Doc, can I say something?
Okay, you can say something.
The hemorrhagic stroke is very deadly.
You're right.
Did you know?
What he's doing there?
No. See, I know. I've heard the hemorrhagic stroke. No, this guy had one. If I'm right, Jimmy Fox.
Sorry, I didn't.
Look, let me tell you,
they saw it.
99% of the time, hemorrhagic is killing you.
Yes,
Because that one,
they saw it early.
I'm telling you.
But
Let me listen.
Okay, I've not, so let him tell you
I'm
the
telling you,
difference.
yes. Hemorrhagic is the main full stroke. That one, your brain is busting. The thing that is carrying the blood, it
I
will
was coming
bust.
to say it. You see, I was the brain. Oh, there was a blood clot there, and he said he was feeling headaches.
Okay.
Right, so the headache was very severe. Now he was trying to take aspirin, and you know aspirin too. It's like lightens the blood.
Okay.
So when he took it, he went off.
He took the
He
aspirin.
didn't take the aspirin. Like before, before taking it, he went off off NT, and they took him to the hospital. And the doctor told him that if he had taken, because the thing was a blood clot, my brain if he had taken it with that one, it wouldn't have been okay. Like he would have died.
If he had taken the aspirin.
He would
That
have
means
died.
that he had a hemorrhagic
Yes,
stroke.
That's
he
what
would
I'm
have
saying.
died. Right. Yeah, so they did surgery and some stuff, and he went for physiotherapy, and now he's okay.
So that brings me the point. I mean, we have two types: the ischemic and then the hemorrhagic. The ischemic is basically a clot. When you say a clot, abortua, that's happened to be in the brain, if you like. You understand? So the blood supply to the distal part of the brain, the other end of the brain, is. Am I speaking too much technical?
No, it's okay.
No, I'm from the elite streets.
Finish.
So the distal part of the brain, onya blood supply. So that part will end up dying. You understand? And every portion of the brain and what it does. So there's a portion for
Walking.
There's a portion for walking. So you can have a stroke where you are walking and you can't talk.
You can't talk.
You can move whatever.
Yes.
All you can do
That's
is
the
talk.
mild stroke.
Whereas what can mild stroke? I'm seeing now mild stroke and it was making hemorrhagic and shut down.
Okay, go.
So obitimiya stroke, like they will be walking but they can't talk.
They can't talk.
So you can be like this. You can be a stroke patient.
Nti emu before ni na. But
You don't understand.
You can't
the
even bring
language.
out anything.
Yes,
but
but mild
they-
stroke.
You see some people walking pa earphone shana so is on
It doesn't
kasa.
mean the
Say,
person has
"Uze,
stroke. Now,
uze,
stroke,
uni
yeah,
asa,
pan
nipa na
and
say
ten
earphone hyɛ na so o kasa na ho ɔte a. Hey, ebi mu we dey near hemorrhagic
See.
systemic stroke.
You started the define ischemic and hemorrhagic.
Please
you-
define
It
it. Now,
also
which are
also
many-
two
which are
times
many-
there. Ischemic
Ischemic and
hemorrhagic.
Hemorrhagic.
Back clot.
and about here blood flow.
And the other one also, once a blood net free vessels, once in the vein, it can burst.
Yes.
And once
That's
it bursts,
hemorrhagic.
more like you are bleeding.
Yeah,
Yes.
I
You
know.
bleed
Then there's
in
a
your
bleed.
head.
Yeah, that one happened.
And that is dangerous. 99% of them die.
That is very dangerous. A lot of
Yes.
them may not survive it. So those are the two main types of stroke. There is another one. That's what a transient ischemic attack. That one it makes you feel like you're about to have a stroke, but really you've not had a full blown stroke.
Okay.
But so the two main types, the ischemic and the hemorrhagic. So one may ask,
Who is that one? Why are you coming to me ask?
no, one may ask is what can cause someone? I think that's what everybody's interested in.
Yes.
What will make you susceptible to having a stroke?
Stroke. First one, they can curse you. You get stroke. Second one, if your mother have had stroke before, you will get stroke. Then, thirdly, if you have too much sex, it can enter you.
Doc,
Oh Joo, you to tell me what
I
you
mean,
think. Do you agree with him?
I agree with the sexual part.
That
I
if you have sex, you can have
yeah, I've
stroke.
heard of even masturbation. If you masturbate too
It's
much,
all part of
you can
sex.
get sex with the hands. You can get stroke because even like how you know is when you are getting the book with me come.
Yeah.
It's a stroke.
It's not a
They
hand,
come
it's
better.
it's an experience hand. Look at that.
They say we are not. Hey, can be any stroke. And sometimes you.
I was going to say that and I said, oh, Jimmy. Not knowing.
When some no juma your mama.
Oh, this boy. Candidate for stroke.
Yeah, so I think with the sexual part, the masturbation and having too much sex can cause that. I don't know if it's true or
It's
not.
not true.
Yeah.
So
And smoking too.
Yeah.
Smoking.
So all the things that you said, I don't think they are right. The first one about cursing, I don't think cursing can cause stroke. I mean, I'm not. I don't believe in that. That
Okay.
can curse you.
So
can get
if you
stroke.
don't believe, just say I don't. Don't say it cannot cause.
Okay, I don't believe that
Good.
it can cause it.
Good.
That will curse you and all of a sudden you get stroke.
Good.
I think that there are causes. There's something that we have.
Do you know that cars can get accidents and people will die, and it could be an automobile fault, but they can curse you and you get accident.
Who is going to curse you to get
Me like this, I can curse you.
I've heard
He's
you.
wicked.
I mean, I don't agree.
It's
You
wicked.
don't
think
agree
I
to my
think-
curse. Yeah. Why am I not make curse? You won't
Eh,
agree.
yeah, who?
Opa yim bibi.
I am a baby. A baby.
But is it true
That was.
that
So the curse, I don't believe that the curse, you can
Good,
curse to
good.
get a stroke.
That's,
and the second one is
spirituality.
what did you say?
sex?
No,
too
no,
much?
it's
If it's in
second
the
one
family.
is family.
Yeah, there's an iota of truth in that. Like if stroke runs in the family, there's a chance that I can also get stroke. And the third one is sex. Having too much sex cannot cause stroke.
Yeah, dog. When you're more super that.
Having too much sex cannot cause stroke. It cannot.
It
cause
cannot.
Stroke. I mean, you can have stroke at any point in your life. Do you understand? So it could be that you're about to have your stroke, and coincidentally
sex
you were
came
having
inside.
sex.
Ah.
Fair enough. But the fact that it means that if you were not having the sex, you wouldn't have had stroke. That is not true. Or sex being a direct cause for stroke is not true. Again, let's group it into two.
Out about smoking.
Smoking, yes.
Yeah.
You
And
mentioned
alcohol?
smoking.
Yes.
And alcohol, yes. It
Yes.
predisposes you to having stroke. So let's group into two. The modifiable risk factors, the ones that you can do something about to prevent you from having stroke. And the ones you cannot do anything about. Thankfully, the ones you can do something about to prevent you from having stroke is about 80%.
Good.
Or even 90%. Do you understand? So the number one risk factor where if you are not careful, it can let you have stroke is who wants to guess?
It's alcohol,
Smoking.
So it's hypertension.
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 Ah.
Not taking your medications regularly. Because if you look at it, if you think about it carefully, hypertension is high blood pressure. So the blood in your veins moving with high pressure. So at a point in time, it can what?
It can best.
Best.
Yes.
So it can cause uncontrolled hypertension. And I find it quite ridiculous that people think that me, I'm hypertensive, but I won't take my medicine, I won't control it, nothing will happen. If you go to the stroke unit, if you see people who are having stroke, most of them
They don't
they
take
were
that
hypertensive. They didn't pay attention to their
High blood pressure.
high blood pressure. Another one is cholesterol,
That too can clot.
Low cholesterol high.
Yes.
lipid profile. You see, what the cholesterol does is that, let's take it as, you have your vein is like a pipe. Cholesterol is like fat.
Yes.
That's how.
Why I'm saying
So
clot it.
it attaches itself to the walls of the pipe. So when it attaches itself to the walls of the pipe, at a point in time, as it builds up, there will be a point where it will clot. It will clog the inflow of.
The pipe way.
Yes.
Way. Yes.
Yes, arthritis.
I be.
Me
Arthritis
say. Me say. Me say.
Oh, who from street? Me
So,
from
so
street.
medically we call it atherosclerotic plaque.
And na mambo di na say
A
arthritis.
friend atellus clitoris.
Is the name again?
When they mark you-
What do you mean atellus?
atherosclerotic plaque.
Atherosclerotic plaque.
Yeah.
Sclerotic.
So they align
ACP.
themselves to the walls of the
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 veins.
vessels. Into blood flow no there. fine to me, family. So that one can also, if you don't, some people too, their cholesterols are high. And the other one is diabetes.
Yeah.
So all these things increases your risk. Another one, like you said, will be genetics if it runs in the family.
Yeah.
Let's talk about the science.
I want to tell him something about stroke.
Okay.
So when you get the symptoms and you go to hospital fast, they can return it.
You go to hospital, what?
Fast.
Again?
Fast.
Good. So it's an acronym that we have
We
used.
know. Me, I've done.
We have used to help people
We have gone to
who have had
market.
stroke so that I can identify it
Look,
early.
we have gone to market to go and do concert there with fast.
Okay, so what are so
He
F,
has no
so
idea.
F is what?
This man has no,
No problem.
idea.
So F is
Let
what?
me admit
Fast.
that he doesn't know.
Me, I know.
The
And
fast.
that thing.
He should beg me before I
Okay,
give
me
fast.
now I'm begging.
You are begging.
Yeah, so
Please don't
so,
beg him.
so,
fast.
so fast is an acronym that we use so that
Yes.
if somebody is getting a stroke, any lay person or anybody can see it and like
We can turn.
Yeah. Number
This
one is
person may be
facial.
having-
Facial what?
You know.
Yes.
facial what?
Facial weakness.
Okay, that's true.
No.
Clap
it's
for
not-
him.
Good. But I don't got any weakness. Facial, baby.
Paralysis or
Facial
That's what I said.
something.
Facial paralysis.
Then A is arm
so
weakness.
so we'll get there. So with the F, so when you see that somebody, when you suspect somebody may be having a stroke, you can tell the person to smile, and no matter when they smile, there will be one, like you see, there will be, it will shift.
What if say or your hip hop artist? Because the win.
No, say one of them. It's the independent say when you stroke, who's a autonomous, or all of a sudden the face would change. Just like what Suarez is doing.
I don't know. What trim is that?
Oh Joo.
I don't know. What trim is that?
So that is F. What about A?
Arm weakness.
Yes, so there will be some weakness there in the arm or the limbs.
Ti ano so baka on pejani sanitary.
Yes, so can say on page and na share say.
Now, you see, when we started, 9% me DB, no. So me see, Obia.
Ah, tina, okay, say page yes.
I wanted
Obi anya stroke no there bet na.
Yes.
Okay. Ana
S.
Let's hear that.
When I start to answer now, I start to answer.
4 letter word.
S, okay.
S no yet. That's great. Rough, but it's simple.
Okay.
Kai me and I was say minim. In the my kai just
minimum.
Means to meaning.
Boa me my kai dey too. Boa mba ba say uni.
Okay, sled speech.
Sled.
Speech.
Yes.
And yes, a sled with speech. Acronym no yeah. F for face, A for arm, S for speech.
speech, okay.
The speech no. What is causing the speech to be part of any sled? No?
Okay.
The speech.
Walk emba. Or try so kasa but we say all of a sudden when you accent.
Yes.
And yes.
Really?
Yes.
Sled. What is sled? I say.
Me tell you.
Sled and
Yeah, man.
that's sled.
Yeah, man. Yeah, man. And you'll be answering, yeah, man.
They try to talk but it doesn't
Yes.
Oh, yeah, I witnessed one. Oh, yeah, so yeah, British accent.
Yo, why are they?
Was give me water.
Good. And then T. Yeah. Is it time? T time.
Yeah.
Time now would be call hospital. No, you have to be fast. Not
come.
afraid for
Time
help.
to call an ambulance.
Good for help.
So you see, as soon as you see these signs, because time is brain.
So let me go over it. F. Uti.
Meaning that.
Can F for
A face.
face because the facial.
Facial weakness.
A for
Arms.
S for
Speech.
good. T for
Time.
T. Obi benya stroke. Yeah, fast. Yeah, fast.
Do you know that if normally within 4.5 hours, if you're able to catch it, you can reverse stroke.
That's nice.
Like you can reverse it forever.
Yes. So if it's a clot, they can give medications that will melt the clot. Okay, it's called thrombolysis or thrombolysis. To melt the we've done quite a number. So you give the medications in there to melt the clot. If the clot, you can even go in the brain and remove the clot. That one
Within
is called
4.5 hours.
thrombectomy. Yes, within 4.5 hours.
Thrombectomy.
Yes. If you, so that's why it is important. That's why I say be fast.
Yes.
Stroke. When somebody has stroke, brain is time. Every minute that the person is losing oxygen supply to the brain dies. And when the brain dies, it cannot be recovered again.
Sure.
So we need to be fast about it.
Don't you extend the times more?
Who's going to extend the time?
You people brought the time.
No,
Who
we didn't
knew
make the
about
time.
4
We
hours?
did the research and we got to know that if you can come within the first 4.5 hours,
Make
it
it
helps
6 for us.
within 6.
Good. Thank you very much.
Come within 6 hours.
Or 6 if you
But
are from
let's put
Kumasi
the
to
4.5
Accra,
in
you
our
can
head.
come. Yeah.
But if it is bleeding, I said that if you give the medication, the aspirin you mentioned earlier is supposed to thin the blood. If the person is bleeding, if you thin it make it worse.
Yeah, worse.
But the person already bleeding, you are thin it, will make you bleed. That's probably why the doctor said that if you are taking the
you
aspirin,
would have died.
you would have died.
And isn't there a first aid for people?
No. If somebody has stroke, until you get to know whether it is ischemic or hemorrhagic, you can't make an intervention. Because one of the biggest interventions that you can do is to give the medication that will make the blood thin. So if you are not sure whether it is ischemic or hemorrhagic and you just go in and give the medication, you can make it worse. What is the number one risk factor for stroke? Hypertension. So normally, the doctors will tell you that, look, do not take hypertension lightly. So we encourage that you check your BPs at home. The normal BP, with the BPs, there's one at the top.
And there's one
down.
It's called improper fraction.
So more diastolic and systolic.
So which one is diastolic?
Diastolic is the small one. Systolic is the high one.
All right.
I can't call him systolic.
So the systolic.
It
didn't all top.
Improper fraction. The all top and the high one.
And
Is the systolic.
Okay. And the one see anything.
Boom, stolic. Boom. Chakalaka. I
So you have to check at home. But unfortunately, people do not know how to check BP at all. And they always record the wrong ones and come and present it to the doctor. Because the doctor sometimes is interested in your BP profile. So we tell you that check at home and come and show me the numbers. But people do not know how to check it. So today, here and now, once and for all, we need to know the right way.
It's not going to be once and for all. After you've taught us, we have to
once and for all. Let's get this in our head. Let's get this. Let's get this into our head once and for all. It's just like, let's get it straight. What I say, like correct one.
My man got the once and for all. Okay, that's a onye biome.
No, that's not what I mean.
And then that's what you said.
Okay, no. Let's get this once and for all. I said, just say.
Why is it?
It's an opportunity to get. So
it was you. How no person how? By street, you know.
Yes, so many. BP machine, yeah,
wait.
BP machine.
Thermometer.
Yeah.
Your thermometer.
Anemometer.
What's it name?
BP machine.
Anemometer. Electricity meter.
Bruh.
Tell him what the name is.
Mamometer. Mamometer.
It's not called mamometer. It's called a sphygmomanometer.
Then
Sphygmo.
Ono crying. Oh, best me crying. When you come mamometer, and me dream say mammogram.
Mammogram, yeah, breast.
Yeah, breast.
Sphygmomanometer.
Yeah.
Sphygmomanometer. Can I hear?
Let's continue.
Can I hear?
Yes, sphygmomanometer.
Once and yes, speed.
And one can speed.
To one can teach
Dog, figmo.
And yeah, figmo.
Ejida da misim.
Ye.
O say sphygmo manometer. Manometer. Sphygmo manometer.
Manometer. Can you look at your camera?
Sphygmo manometer.
Good. Yeah. Doctor also can.
Sphygmomanometer.
Good. I can't
Good. So the correct way of checking BP, so that you don't give wrong readings, and a lot of people do it at home. Okay, so today do we have a sphig around?
Oh yeah.
Okay, so Suarez,
how many times have I saw you sphig manometer?
So you're the fatwa. Sorry. So sorry. So with the checking of the BP, it's step by step. The first thing is that before you check your BP, you shouldn't have eaten. The last time you probably have eaten should be the last 30 minutes.
Okay.
So you shouldn't have eaten before 30 minutes before you check your BP.
Why?
I'm just telling you. When I finish, I'll give you all the reasons. What the BP episode?
So what's your moti asemase?
So don't go and eat with them 5-10 minutes time. Hey, me checking my BP, then you go and check. No. So within the first 30 minutes, you shouldn't have eaten, especially anything caffeine or energy drink or even the coffee. But in the last 30 minutes, you shouldn't have what eating. So now, let's say you've not eaten in the last 35 minutes. So you want to now check your BP. You go and sit at your chair, where you want to check your BP. And then you support your back.
Can you say sit on your chair?
What did I say?
You yourself, what did you
I
say?
don't remember. So you sit on your chair, and then you support your back. Okay. And then you put your feet on the floor.
Okay.
And then rest your arms.
Okay.
You don't cross your legs.
Okay.
So we are learning the right way of checking out.
Oh Joe, do it. When he says it, then you do it.
I question me about me, but mint me bisa. Yeah.
We say.
Oh no.
Okay.
No.
So we are learning the steps. You must make sure that you empty your bladder.
Before
Before you check.
Yes. So you see the right way. So you empty your bladder. You sit, support your back, don't cross your legs.
Is this
And then-
a general and standard rule?
This is the
for
standard.
So the right way is
Is
to not
to sit.
eat. Yes, sit. Fix your back well.
Support
Don't-
your back.
Yeah, don't
Yes.
cross your
Rest
legs.
your arms.
Rest your arms.
Don't cross your
and
legs. Empty your
make
bladder.
sure you empty your bladder and you have eaten like 30 minutes
Or
before
35.
35 or more before you check.
And when you sit down, you should, before they even check, it should be like 5 minutes.
After sitting down,
After
5
sitting
minutes.
Yeah, I
This is next or so could now read this one.
Hey.
So within 2 to 5 minutes,
Okay.
yeah, you can just sit down within 2 to 5 minutes.
Okay.
And then the sphincter should be checked on a raw arm.
Okay.
There shouldn't be any clothing. It shouldn't be over the cloth. And then the cuff. Let me see. This one. One is figuring. So this one. Yeah, normally it should be about 2/3 of your armlet.
Okay.
It should cover about 2/3 of it. And then you should be able to put 2 of your fingers inside.
Inside.
It shouldn't be tight.
That's what I'm saying. So it means it shouldn't be tight because you can put 1 or 2 fingers inside. And then this part should always lie in what we call the cubital fossa.
Where is the cubita? Show it.
This place.
Show yours to the camera.
So it can lie there for you. So then you can now take your time and then check. Normally we also want the hand to be at the sphincter to be at the level of your hand. They all seem to be at the heart level. We want to check your left, preferably, but you can do both.
Okay.
And then you now check your BP.
Okay.
When you check your BP, you check it 3 times, about 1 minute apart.
Okay.
And then
Are you people listening?
Yeah.
You come and demonstrate.
I'm
This girl, you come and
understanding.
demonstrate.
And then when you check 3 times about 1 minute apart, you take the last 2 and find an average. Then that is your BP.
Say that again.
The last
So,
one.
after you satisfy all these things, that's your correct BP.
Say it again. You check 3 times.
Forget the first one. Some people will want you to add all the 3 divided by 3. But normally I would make you do it 3 times. And then you take the average of your last 2. So the top one, if you had 140, 130, you add it divided by 2.
Okay.
Then you record that one.
The top one is called systolic.
Yes.
And the down one is called diastolic.
Yeah.
Okay.
So then you record it.
Okay.
That is your correct BP.
Okay. That's good.
Oh.
So can you
And
demonstrate?
this is important because
Can you demonstrate?
This is important because if you record it wrongly, it will affect the medication you'll be. Sometimes, and all these things that I said increases your BP by sometimes maybe about 20, 15, your systolic. If you cross your legs, if you are pressed, if you want to urinate, all these things, if you've eaten, they can all shoot your BPs up. So you have what we call a pseudo hypertension. but you are not hypertensive. Okay. It's after you've done all this, and you see the first reading normally is high. So I don't know if it's anxiety. There is one called a white coat hypertension. Those people, whenever they go to the hospital and they check, their BPs are high. When they check it home,
it's low.
Yeah, because sometimes they feel nervous.
Yes.
So
the home one is better.
Yeah.
That's why we need to understand how
To
BPs
do it.
are checked at home. So, Oh Joo will give us a recap, and then we'll demonstrate this, and then we all know how to check our BPs.
Good.
Then, Oh Joo, so
First of all, this is Esfido manometer.
No. Don't do that. Fido.
Makaze Fido.
Okay. Okay, go on.
So
is that what?
before you check your BP, your blood pressure, you should pee.
You should first of all have the machine to check. Or
Me call pharmacy shop.
say still you use the machine.
Now then me who say pharmacy shop also me every machine.
Because they have say
it's there. That's why
so
I'm
what's
going
the
there.
name of the machine, keke?
Me say Esfido manometer.
oh, around
Make out as if you do.
Sfido.
And then when you are checking your BPs, you don't talk. Until you
But
are
he's
done.
allowing me to talk.
Are you checking it?
I am. I'm about to.
Are you checking
I'm about
it?
to.
It's called
I'm about to.
Sphygmo.
Sphygmo manometer.
Okay.
Good.
So it's a gene. Now, before you check, make sure you have not eaten for like 30 minutes or more, and also you pee.
Empty your bladder.
Empty your bladder, and you sit down. Fix your back well, and also don't cross your leg.
Good.
Yeah, and also your arm to
Rest them.
Yeah, rest them, and wait for 5 minutes.
Yeah, 2 to 5.
2 to 5
minutes.
Okay.
And then you take your sphygmo
Okay.
manometer.
As it's fake.
Yeah,
Yes.
your sphig baby. Now when you take it, make sure.
Your arms are free, right?
Yeah.
Like there's no cloth.
Yeah, make sure that like it's just a bare arm. There's no cloth. And when you open it and you are fixing it, you can fix it on either left or right, but you say it's advisable to use
Preferably the
Yeah,
left.
preferably the left. And when you put
So go
it
your
there,
left, or you want to? Okay.
okay. And when you put it there, you said it should be this pipe should align with the guitar one side. Which one? You said what?
I said cubital fossa.
Cubital something. So the line should be here, right? And it shouldn't be tight, right? So when you do it, make sure like you can insert 2 fingers,
At least
2 fingers, right? So
you have done well.
now when you check, you have to check like 3 times.
Okay.
Yeah, you said the first one they only said in here, but some people they can add the 3 and strike average. But the 2 and then here.
First two or last
the
two?
last 2, the hammer. You like the last 2, and then you add it up, and then you strike the average, and that will be.
And then you don't talk.
And your star is wrong because the sphig is down. It shouldn't
should
be
be at
down.
the level of your.
So can you put it on your tie?
Why not?
Good. So it's like this, please.
At this, at best, if you had a table that is
Table.
up a little, then just
Good.
put it there. Then you record. 3 minutes. How many minutes apart? You record
1 minute
like
apart.
1 minute apart.
Yeah, 1 minute apart. So can we do now? So doc, this is it.
Okay.
Then you turn it on.
So it
Keep
should be at
it on
the
the
level.
level. Keep it on the level,
Sorry,
my brother.
Sorry. So you keep it on a level.
Yes.
If there was to be a high table,
Yes.
So then let me relax.
Good.
Let me look cross my hand. But don't saw them kakra. So you turn it on.
So ideally, you should empty your bladder.
You look like predator.
You don't talk. You don't talk.
Don't talk. The thing is rejecting you. So, am I checking a human being? Have you received your number? We check the numerator and the denominator. Can you hear?
Doc, can children get stroke?
Yes. Anybody can get a stroke.
Anybody at all?
There are
Because
who are
children can
hypertensive.
get diabetes. So yeah.
Which type?
Give me the types, I'll choose.
Forget it. It's okay.
Yes.
So this one, I'm done with the first one. That means I should wait for a minute
And then
so that I can
check
do the
again.
second. Okay, I'm
And
sure
then-
it's past a minute now.
No, but don't do it again.
I won't do it again.
And
So
then,
when you are diagnosed or you get the stroke, is there a cure for it?
the stroke can be managed effectively to the extent that you can actually come back to your full
Normal.
Yes, normal. Especially when you take your medication and do your rehab
Both
or your
strokes.
physio. Yes, both strokes. But just that the chances of you recovering from a hemorrhagic stroke, that's the
very
bleed
low.
is very low. But both strokes, you can, if you are managed effectively, you can.
I think the advice to people is they should be they should be fast.
Yeah.
Yeah, when you
Yeah,
see
that-
that somebody.
I think that's
yeah,
the take-home message.
Yeah, so you should be fast. And the fast, he said the F stand for facial weakness. The A is for arm
Weakness.
arm weakness. The S is for speech, and the T is for time.
Time to call the emergency or
Yeah,
rush
so we should know this. Now, BBA have a stroke, sign, just do it. Because you need first aid for stroke. Say, be in your stroke, it's a oh man, I'm CPR, and I say, oh, yeah, and say for 3 minutes. You just have to be what? Fast, and take them to the hospital. Now, woman, it says 4 hours?
4.5 hours.
4.5 hours. Right.
So I begged you to put it at 6.
So within 6 hours, please
Yes.
get to the hospital.
And then you should have this at home.
Okay, that's good. That's a good advice.
Yes.
And you know how to check it
Check
well.
it. Yes.
And if you go to the hospital and the nurses are not checking it the
Yes.
way you want, tell them that please.
It's not about the
my-
way you want. If they're not doing
the right way.
the right way.
The right way. Please check if I've peed. Check if I've eaten like the past 30 minutes or 1 hour. Check if my legs are crossed or I'm K-legs or whatever. Check
Check
all
it 3
these-
times.
Yeah, 3 times. Because one time, so and next time I'm going to do my homework because this guy, he's more strict than I am.
So everything you call. And please, nurses or any other health practitioner watching us, if you think what we are saying is false or it's not true, you are free to comment. You're free to tell us that this is not what we learned from school.
Yeah.
It's not true that you have to say it. Come and tell us. But truly, if you know the standards, because I know that they've taught you sphygmomanometer. If you know it, you don't educate your patients. I mean, that's not too good. Please do the right thing. Let's all save lives. Yeah. Doc, you've been a wonderful host and resource person.
Thank you.
We have to give you an award.
Give me an hour. Give me money. Give me dollars. And I say dollars now.
Hey, dollar. What can we do to the systolic of the dollar? So thank you very much. Once again, we are from where?
Call Media Studios, Westland 65.
So, I dare you. Come baby.
Now,
Bush boy.
See, bro, we are in the boulevard.
What's the name of the studio?
It's a studio. What?
Bush boy. Core Media Studios from 65 Boulevard, Westland. Please, next time, please patronize Oh Joo's shows. He's doing amazing. Whenever you hear his shows, go out there and enjoy it. And whenever you go on YouTube, click on Health Quarters Ghana. You find Dr. Assan, fantastic doctor,
Yes.
very brainy doctor. And you find Clemento Suarez, the one who teaches the doctor.
And
See
make sure
next
you
time.
follow them on your social media.
Now, as you're going, we are going to continue our fight.